these are not guidelines. This is just ways of how a primary care provider might approach an issue. And I would like to talk about prediabetes today. And prediabetes, it's a condition where there's basically insulin resistance. So your body makes insulin, which allows you to take the sugar in and be used for energy. And what happened is that for some reason, some people start resisting their own insulin. So what causes the pancreas to start working extra in order to compensate to that resistance. And as it starts working more and more and more, the pancreas starts to die, and eventually the sugar starts to go up, and it starts. We call it prediabetes or insulin resistance any sugar that is more than 100 milligram per deciliter. So in the fasting blood sugar, you would see that it would be a 99, then it gets to 100, 101, 102, 103. Eventually, it can reach 125, and 125 fasting twice, we call that diabetes. And by the time somebody gets diagnosed with diabetes, that means they lost probably 50 to 70% of the pancreas. Some people say that would be the level at one point the body can no longer keep the sugar at a certain level. It reaches 125, and we chose that number to be diabetes. The other way we diagnose diabetes is by looking at the hemoglobin A1C. So any hemoglobin A1C between 5.7 and 6.5 is pre-diabetes. 6.5 and above is diabetes. And with any pre-diabetes, basically what you would do is you will call the patient and you would say, I would like to let you know that your body is resisting the insulin, and you give the explanation that I gave you before. And then in my notes, what you would do is you would type that LR, pre-diabetes, and then you pick the teaching component or the assessment and plan. And but basically what you tell the patient is you want the patient to lose weight, you want the patient to increase activity. That would increase the amount of insulin receptors in your body, which would allow you to use the insulin being produced more efficiently. The decreased weight, as you decrease weight, you decrease abdominal fat. That decreases insulin resistance. So you tell them to avoid rice, pasta, bread, sodas, anything that has high carbohydrates. You ask them to start exercising regularly. And then what you do is you order and monitor hemoglobin A1C, and you also monitor the fasting blood sugars. And you do that every 3 months, and you bring them back, and you explain to them the numbers they're getting back. The most important thing about insulin resistance is that once you start catching them in pre-diabetes, this is your chance to make a big difference. This is your chance to prevent them from developing diabetes, which is a big disaster for the patient, because automatically everything changes for us. For us, it's like they already had a heart attack. For us as a provider, it's like we're just waiting for the second one, and increases the risk of amputation, blindness, renal insufficiency, impotence. All those things go up once you become diabetic. So if you catch them in insulin resistance, and you're able to help them change their habits in eating and their habits in exercise, and you track it every 3 months by ordering hemoglobin A1C and fasting blood sugar, you empower them to prevent one of the worst conditions that they could ever develop, that affects every part of their body. The other thing is that don't think that just because they're pre-diabetics it's not a big issue, because within 6 months, within a year, maybe within 10 years, they will become diabetics. And there are a lot of people that are walking out with insulin resistance, and they might not know they have it, and when they found it, they say, oh no, it's just pre-diabetes. It is not just pre-diabetes. Your body's trying to compensate for that resistance, and that's why you don't see how bad things are. But as soon as they hit 100, you want to make sure that you make them realize that this is a big problem, and it can have very negative consequences in their health.